Good evening, everybody, and welcome to our second community webinar with regards to COVID issues. Thank you very much for joining us this evening. Appreciate it's a commitment from yourselves to join on an evening at 6:30, so we're very appreciative of that. We've got a number of people which I will just go through in terms of who is joining on the webinar. But firstly of all, just to say that the core subject will be around the current response to COVID, where we are in terms of current numbers within the borough. And also we'll be going on to some specific topics where we've got expertise to go through that around such things such as vaccinations, which I know is something which a number of the community are already contacting the local authority about issues on and where we are in terms of the rollout of that. So in terms of who we'll have speaking today, we would have Councillor Graham Henson, leader of the council, coming along, but unfortunately Graham is unwell at this moment in time. He sends his regards and his thanks to you all, which I know a number of you will receive the messages he sends out on a regular basis as part of our community leaders, and also the My Harrow messages going out to residents in the borough. But he just wanted me to let you know that he's very grateful for all of the hard work, all of the endeavour, and all of the things that you're doing to keep Harrow safe and for us trying to break the chain of infection at this moment in time. So I'll firstly introduce Sean Harris in a moment, the Chief Executive of the local authority. Sean will cover some of the top line messages around what the council is doing. I'll then hand over to Carol Furlong, our Director of Public Health, who will give you a bit more of an in-depth analysis about where we are with the current pandemic and a number of things that the council and our partners are doing to support the current lockdown arrangements and try to take us out of that. And then we'll hand over to Dr. Genevieve Small, who is chair of the local Harrow Clinical Commissioning Group, where Genevieve will be able to talk more about the current primary care response to COVID and also the vaccination programme, given the fact that that is an NHS-led programme delivery at this moment in time. Just a few things around housekeeping. So this is a webinar where ultimately you are only on what is known as a see and hear mode. So you won't be able to interact through anything other than the Q&A, so the question and answer slot, which you have access to on screen. When you post a question, if you could let us know who you are, your organisation, that would be great. It just helps us understand some of the nature of where the question is coming from. But what we'll do as we get into the Q&A at the end of the session is I'll be able to direct questions to the relevant member of our panel. So please ask us any question that you feel you need the response to. There may be other members of the community who are thinking exactly the same. And one of the things we will do is we will compile responses to all those questions, especially the ones that we don't get through when we move into panel mode, so that we can then send out messages to yourselves so that you can then send out to other members of your community and the networks that you've got established. Because one of the things we want to do is just amplify the messages from this evening to get out into the community, to make Harrow remain safe and become safer, and also break the chain of COVID infection. So without further ado, I'm going to introduce Sean Harris, Chief Executive of Harrow Council. Sean, over to you.
Thank you very much, Alex, and thank you everyone for joining us this evening, and also thank you to my fellow panel members who are here this evening to do a number of things, give you an overview of where we are in Harrow in relation to coronavirus, the work that we are doing across a whole range of different areas in order to be able to, as best as we can, tackle the challenges that we have, both in terms of what we are doing now to break the chain of infection, to increase enforcement, etc., but then also looking forward about how we ultimately get out of coronavirus, which will be very much focused around vaccination, and in order to tackle the infection. It's not that long since we had a conversation just before Christmas, where at that point we were highlighting that cases were beginning to rise rapidly, there was significant concern, and that the council was seeking to interact with local community leaders, whether they be from voluntary organisations, faith organisations, the community, or individual members of the public, to try and effectively work together as much as we possibly can in order to be able to get messages out into the community about what we need to do, both in terms of hands, face and space, in terms of making sure people self-isolate if they need to do so, and also that people should get tested, because we were very concerned. People will know that shortly after that webinar, the number of cases nationally and in London and Harrow increased enormously, which led to first tier 4 restrictions and then a national lockdown. Clearly, the situation that we've been facing in Harrow and nationally around coronavirus is very grave. People will have seen today that there were over 1,600 deaths that were reported, which is the highest single number in any day since the start of the pandemic. So whilst, and Genevieve will talk about this, there is hope on the horizon because of the availability of a vaccination programme, it is incredibly important that we work really, really hard to continue to break the chain of infection, and that we act, as the government has said, as if we all have the virus, and we all make sure that we work as effectively as we can to stick by the rules, to do what we're being asked to do, and that we work effectively together. It has been very clear to me and my colleagues that the role that voluntary and community organisations and faith organisations have played in Harrow in tackling coronavirus has been enormous, both in terms of help and support to individuals in the community who are suffering, supporting people through the challenges of 3 lockdowns, but also incredibly importantly, getting key messages out to local people about the role that each individual and each community can play in tackling this terrible virus. And I think one of the things that we want to do this evening is through, in particular, the information that Carol gives you as Director of Public Health and Genevieve gives you as someone who is leading the vaccination programme in Harrow, can equip everybody in on the webinar with the information that you need in order to be able to give messages to your friends, your family, your community, your congregations, etc., in order to be able to, for us to continue to work together. So your help and support, both individually and collectively, has been incredibly important to Harrow in terms of how we've responded to the pandemic so far. And we hope that through the information that we share with you this evening and the questions we're able to answer, that you can redouble your efforts to help and support getting those key messages out over the next few weeks. So thank you, Alex, and hopefully that sets the scene for tonight's webinar.
Brilliant. Brilliant. Thank you, Sean. That's really, really helpful as an introduction. And I was remiss to actually introduce myself, so apologies for that earlier. I was that excited to just get through the agenda and get onto the main event of our speakers that I forgot to say. I'm Alex Dewsnap, Director of Strategy and Partnerships for the Council. So next up is Carol Furlong, our Director of Public Health. So I'll just pass on to Carol now. Carol, thank you.
Hi, Alex. I'm just going to try and share my screen. It worked earlier. Here we go. Are we seeing that? Yes, okay, yes. That's great. Thank you. Yeah, I'm going to give you a quick rundown of what's happening in COVID. But before I start, I just wanted to say a huge thank you to everybody out there, because we did see that huge increase around Christmas and the beginning of the new year. And it's really obvious from the data that I'm going to show you in a minute that people are adhering to the lockdown, and we are starting to see that light at the end of the tunnel with the cases starting to come down. We're by no means at the end of that tunnel yet, but you know, people have been doing their best, and so thank you so much. You know, you're saving lives by staying at home. That moved down, there we are. So this is the dashboard that I produce to show you where we are in terms of coronavirus. And you can see over here in this little graph how high the numbers got. We were almost 1% of the people in Harrow got infected in a single week, and that's a very scary thought. So what 1% of us were walking around with COVID. We're now down to a rate of 733 per 100,000. So it has come down a little bit. We've got a long way to go though. It's coming down also in older people, but that's still very high, considering that older people are the people who are most affected by COVID and more likely to die from the disease than anybody else. Our testing rate is a little bit lower than it had been, so we need to get that back up again. And our positivity rate shows that it's 2 in 9, or just over a quarter of people are testing positive when they go for when they've got symptoms and they go for a test. So this is where we are. This first, the top graph shows the whole pandemic. So this first part of the graph shows how it was in the first wave. Now, we weren't doing community testing for the majority of that first wave. So these are only really the positive tests that were ending up in hospital. But you can see how through the summer, the rates went right down and then started climbing in the autumn. We had a little peak, which we thought was really bad. We went into a lockdown, came out probably too early. We needed to get the rates right down. But because we were so high, it really, really took off. And you can see that we had this huge peak and that it's now starting to come down the other side. The latest data that we've got suggests that it's going to continue to come down. So that's really good. But we are still seeing about 250, 260 people every week, every day rather, receiving a positive test. Now, one of the things that we know is that that's only the tip of the iceberg, because we know that 1 in 3 people don't have symptoms. So these are people who've got symptoms and have been tested rather than people who haven't got symptoms. If we look in the age groups, that big swathe of black shows you just how high our rates are. But if you actually can read the numbers are just starting to come down in each of the age groups, starting to come down quite well in the children and young people. And the purple is starting to lighten towards red in the over 65s, but that's still really too high. So we still need to get those rates down a lot more. If we look at ethnicity, we've got a slight overrepresentation. If you compare it to the proportion of people from the different ethnic groups in our population, we've got a slight overrepresentation in positive COVID tests in the Asian community, the Asian Indian community, and the Asian other community, which in Harrow is predominantly Tamil and Nepali. And we also have a slight increase in the Black community as well. And that sort of fits with what happened in the first wave as well, where people were disproportionately affected in the BAME communities. It's also showing what's happening in the hospitals, where they are seeing more people from the Black and minority ethnic communities being admitted to hospital. And we think it's also reflecting in the death figures. If we look at it geographically across Harrow, you can see that there's a variation, but it's not a particularly consistent variation. Some weeks, some boroughs, some wards are high, and some weeks, some wards are low. But we are seeing some places at the moment that have got particularly high rates in Roxeth and Wealdstone and Kent and West. Those are the highest rates this week. or last week rather. So as I mentioned, the death rate from COVID is still going up. So when we see the figures start to come down, we've got to remember that there's a time lag, and the people who've become ill with COVID don't immediately go into hospital as soon as they become ill, and they don't immediately die from COVID. So there is a time lag on our data that is not going to peak for another couple of weeks at least. So you can see that the COVID deaths are the orange ones here. You can see that's been increasing and is continuing to increase at the moment. And my sympathies go out to all of the families that have been affected. So there are things that we can all do, and I put this slide up last time, and I make no apologies for putting it up at this time, because I think it's really good and it explains things very well. No single action that anybody does will get us out of this pandemic. So there's lots of things that we can do as individuals, and there's lots of things we can do collectively that will reduce everybody's risk. And if you think about each of those actions, there's a piece of Swiss cheese with holes in it, where the virus can get through. The more things we put, the more pieces of Swiss cheese we put together, the less likely we are to have a hole that goes all the way from one end to the other. So keeping your distance and staying home if you have any symptoms and if you have a positive test, washing your hands, wearing a mask, and avoiding touching your face. If you go to a crowded place, then I'd be very surprised, because there shouldn't be any crowded places anymore. But if you are in a crowded place, be there for as little time as possible. Open windows and ventilate, because if there's anybody there who's shedding the virus, it dilutes the amount of virus and it can get out of the windows. Fast and sensitive testing, which I'm just going to come on to in a moment, and the important messaging, which is where you are all really essential in passing those messages onto the people that you know, in your families, your friends, and your communities. I can't stress how important that is in getting the messages out. We don't have a message, a way of contacting every single person in Harrow who needs to know all this information. But the more people who are passing on the information, the more coverage we get and the more information that can get out there. So quarantine and isolation, as we've said, if you have a positive test, and finally the vaccine that Genevieve's going to talk about. All of those things will make a difference and will help us break the chain of infection. So I'm going to talk about testing now. If you've got COVID symptoms, and you'll know these very well: a persistent cough, fever, loss of taste or smell, you need to get tested at one of the symptomatic test sites, and you need to isolate straight away. And everybody in your household needs to isolate until you get the result. If the result's positive, you isolate for 10 days. If it's negative, you can stop that isolation straight away. With the symptomatic testing, we've got various different sites. The Civic Centre, Northolt Road, Box Tree Lane and Northwick Park are our main sites within the borough. And we're looking at an extra local test site, which we're hoping will be open in the next few weeks. We're also, you could also go down to Heathrow or one of the other sites. And the other one that's very close, that's popular for people who are living on the east side of the borough, is the Watling Community Centre walkthrough site in Edgware. As you can see from the graph, that, the numbers of people that were tested increased in that first week in January, with that peak that we saw. We had 9,000 people tested, which is 1,000 1,500 more than our usual rates, and it's come down a little bit in the last week, but we still need to get lots of people tested so that we can get these rates down. As I mentioned before, 1 in 3 people with COVID don't have symptoms, so they don't go for testing, but they could be spreading the disease. So we're testing people without symptoms now using this new technology called lateral flow devices, or LFDs. And they're really, really good at picking up people who are infectious. So people who've got high viral load, their tests will come back positive and they'll be able to isolate. So anybody can have it, but we're recommending it for anybody who's an essential worker, including people who work in the voluntary sector, to have tests twice a week, because if you've got a very low rate of the virus, within 3 or 4 days of having your next test will turn out to be positive, and that's the point when you're infectious anyway. If you're not able to work from home, you should test twice a week. And if you're a family of an essential worker, you should also be tested at least once a week. But I stress, anybody can get tested. So if you leave your house, if you leave your house once a week to go to the supermarket, you can book a test, get tested, and do your shopping and have the results before you finish your shopping. This is our new poster, which you'll be seeing around the borough and on our social media. So if you feel fine, still book a test and go and get it. So when you arrive at the test centre, this is sort of what it looks like. Lots of little booths. They've got mirrors in there. They've got boxes of tissues, and you blow your nose when you arrive, when you go into your booth. And then you use the swab to swab the back of your throat and up your nose, and it's self-swabbing. If you have any problems, there'll be somebody helping there to give you instructions about how to do it properly. You then put the swab into a little tube of liquid and pass that to the person behind the barrier, and they will prepare your test. The booth is then sanitized so that the next person isn't infected if you just happen to have COVID. So the test processor then puts the liquid into a little cassette, and the liquid moves up, and it's a little bit like a pregnancy test. So one line is a test line that shows us that the test is actually working, and then a second line comes on if you're positive. And it takes 30 minutes for the test to process, so within 30 to 40 minutes you should get a test result. Now, I know that there have been a few problems with some people with a particular phone that doesn't seem to be completely compatible, or it's a version of Android that's not completely compatible with the testing system, but I believe that is being worked out at the moment. So we have 5 static sites. We have one at St Anne's Shopping Centre, one at Civic Centre, one at Harrow Arts Centre, and one at the Sri Swaminarayan Temple up in Stanmore. We also have a very small site with only a couple of bays for our essential workers who are based at the depot, and that's not a public site and you can't book that one. We have a mobile site as well, and that at the moment is in Cambridge Road car park in North Harrow. And between those sites, we're doing around about 1,000 tests a day, and between 3 and 4% of them have been positive. And just looking at the data that we had from last week, we tested 6,600 people who didn't have any symptoms. None of them had symptoms, because if they turn up with symptoms, we turn them away and ask them to go and get a symptomatic test. And 218 were found to be positive in the last week. That means 218 people who could have been in the borough infecting people who are now isolating at home for their 10 days and not spreading the virus on. If you want to book a test, you can go to the council website at www.harrow.gov.uk/test. It's It's a very easy website to remember, and you can book your test and you can see all the slots that are available. And if you want to know where the mobile unit is going to go next, the My Harrow newsletter will tell you that. So sign up for the My Harrow newsletter, and then Helen from Comms will be very happy with me for telling you that. If you are asked to isolate, please don't leave your house for the full 10 days. People do get bored, but 10 days isn't a lot. If you can stay at home for that 10 days, it really will make all the difference. You make sure that the people that you live with also isolate for the full 10 days. And this does include not sending your children to school or to nursery. And we have had occasions where that's happened. If you do have any particular needs, you need shopping, you need food, you need prescriptions picking up, or you just need somebody to talk to on the phone, if you contact Help Harrow, they can sort you out. If you're on low income or receiving certain benefits, you could get one of the £500 isolation payments, and I've put the link there at support for residents. The one thing I didn't put on there is if you're a small business and you're affected by having to isolate or having the lockdown, you might be eligible for a small business grant as well, and that is also on the council's website. So if you just put in the council website /coronavirus, there's a link on that page that says help for businesses. I've got some key messages there. It just reiterates what I've been saying, and you'll be able to hopefully download this presentation if you want to use any of it with your communities. And I'm going to stop there and go back to Alex.
Am I back on? Yeah, thanks, Adi. So thank you very much, Carol. There was an awful lot in there. One of the things, just looking at the questions we're receiving, this is being recorded, so we'll be able to put a link on in the next couple of days so anybody can come back onto this presentation. We'll be sending out all slides to people that we've got email addresses for as well. I saw something around if there's any questions for Councillor Henson, then please post them. We can deal with those offline if needs be, or even ask us and we'll do our best to answer them. There's an awful lot of questions also coming through around vaccinations as well. So hopefully Genevieve, our next speaker, will be able to deal with all of those as she goes through a talk on where we are with vaccination. But of course, we'll be able to come back in the Q&A if we don't cover all of those, given the fact that I think we've probably got about 3/4 of the questions, Genevieve, coming through on the vaccination. So, but again, really good interest and really good questions coming through. So please keep posting those. We've already had about 30 questions that people have put in. So keep doing that. That's great. Thank you. So without further ado, can I introduce to you Dr. Genevieve Small, who's the chair of the Harrow Clinical Commissioning Group. Genevieve, over to you.
Hello. Hi. Hello, as Alex said, I'm Genevieve Small. I'm a GP in Harrow, and I'm also chair of the CCG. And as part of that role, I'm also being part of the vaccination rollout programme for the whole of North West London. However, I have to say I feel slightly guilty talking about vaccinations with Carol in the room, because actually directors of public health are normally the people who talk a lot about vaccines. So I'm sure that Carol will be able to help me with some of the questions that you've been posting later on. And I would just like to thank you for posting so many of those questions. I'm going to just talk to you about two aspects. I'm going to talk to you a bit about how primary care is working during this period, and then go on to talk to you about the vaccine programme and hopefully pick up some of the issues that you've raised so far. So as everybody has said, we are certainly in a very, very important situation with the level of COVID cases that we are seeing at the moment. And as a consequence of that, that is having a lot of impact on the hospitals. And it's really important that in order to give the hospitals the space they need to look after the patients that they're seeing, that we do all we can to reduce the level of transmission of COVID so that they can indeed go on to look after patients who need that hospital care. And everything that you're doing to support that effort and maintain the messages that we're talking about are actually helping the NHS save lives. So thank you very much for everything you're doing. I know that people are really sacrificing a lot at the moment, but I can tell you from our perspective, it is absolutely having a benefit. So thank you very much from me. So as a consequence of the fact that we are having to adapt to the level of virus that we're currently seeing, we have made a decision to try and focus on the important, essential and emergency offers for patients' care through general practice. So that means that we are asking you once again, if you feel that there are symptoms that you want to discuss with us that can wait, perhaps that would be the right thing to do at the moment. Now, that's a very unusual thing. We wouldn't normally ask you to do that at all, but I just think it's worth bearing in mind that we are in extraordinary times and we do need to have additional time to be able to look after patients that need us in an emergency or an essential way at the moment. And also, as I'll go on to talk about, we need to free up the team to be able to go on to deliver the vaccination programme. Now, when I say, if you think it can wait, that's actually a really difficult thing for you to judge sometimes. So it's really important that you don't delay if you think that you've got an important symptom. General practice is absolutely open. And so we absolutely want to hear from you if you are concerned about something like a new lump or bleeding or anything that you think is a new symptom that you feel it could be important. You don't have to make a judgment about whether it's important or not, but you do need to let us make that decision. The other thing that we're really keen to be open for is people experiencing mental health issues. Now, we know that lockdown and this year has put a strain on people's mental health as we've not seen it before. So I really, really want to make it clear to you that if you have got any concerns in that regard and you want to talk about any of those symptoms, please do pick up the phone or use the online system to contact your GP, and we can then talk about those symptoms with you. We are still referring patients to the hospital, and so if you need to be referred, that is what we will do. We're also here to look after immunisations, so not just COVID vaccinations, but baby immunisations, crucially important, cervical screening in people who need to have it done, and any of the things that you would think would be part of your normal day-to-day life that we can't wait to deliver, we will be delivering. So I just kind of want to enforce upon you the fact that we are open, we're just being slightly careful in the way that we use our services at the moment. Every practice in Harrow will have a link on their website that takes you to a sort of online questionnaire. So if you're not sure whether you need to bother us or not, then you can go on through that website and you'll be able to put in your symptoms, and the doctor will be able to assess whether they need to deal with that then and there, or whether that can wait. And you may get a message back to say, thanks very much for contacting us. At the moment, we think that can wait. Or we might say, thanks very much, I'm going to give you a ring and talk about that symptom a little bit later on. As you know, we haven't actually been asking people to just turn up to GP surgeries for about 10 months now, very different to the way that I'm used to practicing medicine. But we are asking you, as always, to give us a ring first and to have that conversation with us on the phone first. And then let's together, when we need to, decide whether you need to come into the surgery for tests or to be examined, or whether we need to do a video call. So these are big changes. I know that they're not the way that we are used to seeing our doctors, but they are actually making a huge difference in terms of allowing us to make sure that we're concentrating on our top priorities. And also it's about keeping you safe so that we're not asking you to come out of the house unnecessarily if we can find ways to look after you without needing you to leave the house. We also know that we're working together with everybody else. So we have our local pharmacists that you can always rely on for advice. We know that a lot of issues can be found advice online, and a good website to go to is the 111 website. If you can manage to use 111 online, it's better than phoning 111. They are getting calls for everything, and you can imagine that can be quite busy. So we're trying to protect 111 if we can, but if you want to use the website, that's a very good resource as well. So that's just a very brief overview for what we're doing for GP services. If people want to hear more about that, then I can pick up any questions that you may have. But I thought you probably, given looking at the questions, you probably are most interested in what we're doing about the vaccination process. So this is an incredibly exciting programme, and as people say, we need to vaccinate our way out of this situation. So there's lots and lots of work going on, and we started vaccinating in Harrow on the 15th of December, and we have got currently 2 vaccines that we're using in Harrow. One is the Pfizer vaccine, that was the first one to get authorization, and then the other vaccine we're using is AstraZeneca. Now, I can talk lots about these different vaccines, but I'm wondering if I just might do a few little moments on them and then pick up questions as we need to. So the Pfizer vaccine is a vaccine that's using new technology. It's using something that's got mRNA in it, which is a little bit of genetic code, which goes into the body and then makes proteins that look like part of the COVID-19 virus. And then the body recognizes, oh, that's a bit strange, I've never seen that before. And so it mounts an immune response to that vaccine. And that's how the Pfizer vaccine works. The AstraZeneca vaccine is quite similar, except instead of it being a little bit of genetic code, it comes as a little bit of a protein, and then that goes into the body, and then it does the same thing really as the Pfizer vaccine. It makes a little protein that the body recognizes as being new, and it mounts a response to that protein. And so then this is the way that all vaccines work, actually, because then what happens is when your body meets the COVID vaccine, the COVID virus, your body says, hang on a second, I've had that before. Let me see if I can produce some antibodies to it and some T cells to it. And that is basically how vaccination works. In the UK, we've got 3 vaccines that are approved. We've got Pfizer, AstraZeneca, and Moderna. Moderna is similar to Pfizer, but we don't have that vaccine currently in Harrow, but I'm sure we'll have it at some point. And both of those vaccines, when they got approval, I'm going to pick this up, Bill's question here, had an efficacy benefit of over 94%. So that's very, very high for a vaccine. That was based on 2 doses. I think everybody was amazed that it came up so high. The AstraZeneca vaccine is coming out at 73% efficacy. That is also extremely high, much higher than some of the other vaccines that you're used to receiving. So we're incredibly fortunate that the clever scientists went away and actually manufactured these vaccines, and that we found them to be so effective against COVID. So it's really important that we vaccinate as many people as we possibly can, as quickly as possible, to make sure that we're giving people the protection that they need. So you will probably have heard many times in the news that the Joint Committee for Vaccination and Immunisation, the JCVI, they are the people that have decided in what order people receive their vaccination. And what they found was the most important thing was they wanted to make sure that they were vaccinating people who were at greatest risk of dying from COVID. And that sadly is our older population. And so that is why when we have started vaccinating, we have been vaccinating people over the age of 80. And we've also been picking up people who live in care homes. So that's been our top priority groups. As well as that, we are looking to vaccinate people who work in the health and care, social care system, because we want to make sure that if we keep them well, they're able to keep going to work, which will help look after the population and keep the rest of the population healthy. And then as we achieve those targets, we move down to first of all, the 75 and older group, and then the 70 and older group. And what the government has advised is they want to see everybody I've just mentioned, so everybody over the age of 70 and over, and all health and social care workers, and people who live in care homes, and people who are housebound, who are in those risk groups, and people who are termed clinically extremely vulnerable, or what we think of as shielding. All of those people need to be vaccinated by the 15th of February. Now that is quite some ask, but actually we're making fantastic progress. And we have actually vaccinated a high proportion of our over 80-year-olds. We have vaccinated almost all of our care homes, and we're looking to vaccinate our housebound patients over the next week or so. So we're making fantastic progress, and we're starting to see the benefits of that vaccination program. At the moment, we're concentrating on delivering first doses. We will get to the second doses in about 12 weeks' time, and that's so that we can get that vaccine to the most people in the quickest period. And as some people have mentioned in the chat, there are 3 different vaccination centres that are running in Harrow. There is the Hive, which is over in the Edgware area. There is Tive Farm, which is over in Rayners Lane. And then there's the Byron Centre, Byron Hall, which is at the back of the Leisure Centre. And those 3 places are actually managing to vaccinate a lot of patients. I can see in the questions that some people have had fantastic experiences, other people perhaps haven't had the best experience. I'm really sorry to hear that some of those experiences have not been absolutely up to scratch. As other people have mentioned in the answers, we have actually done a lot of work to try and ensure that the pathways there are absolutely as safe as possible. And a lot of work has been done to kind of like ensure that we maintain social distancing. But of course, we're dealing with people, and sometimes people run late. And so because they run late, sometimes that can cause traffic flow problems. And so it's important that if that happens, we're onto that as soon as possible so that we can make sure that we're maintaining that social distancing, because we really want to make sure that everybody gets their vaccine in the safest way possible. I think I might actually, I want to pick up about where people have said, can we get enough vaccine? So I think that the reality is that we are actually getting a lot of vaccine. Harrow has actually done very well for vaccine compared to other parts of London at the moment, and we don't waste any vaccine. So we really make sure that every single vaccine that we receive, that we can give, we absolutely deliver to our population. And we recognise that we can't give this vaccine fast enough. Everybody would like it yesterday, and that enthusiasm is absolutely essential, because that's what's really going to help us combat this disease. But we know that the most important factor, ethnicity is important, absolutely, so are other conditions, but the most important factor in terms of deciding who gets the vaccine, it's really based on age. The other thing that I wanted to mention was, somebody said in the chat, when will I get my vaccine if I'm age 65? So on the basis that we hopefully will have done all of the vaccine that we have just stipulated in those 4 groups by the middle of February, the next group down will be those aged over 65. So you should be getting an invitation for a vaccine around that point. Lastly, I'm just going to mention the fact that in Wembley yesterday, you would have seen perhaps on the news that they opened one of the new mass vaccination centres where they're able to also support the vaccine programme. And in Harrow, that centre will be at Byron Hall as well. So people will either go to Byron Hall and they will receive their vaccine via the GP service, or it will be the mass vaccination service. To be honest with you, you're not going to notice an awful lot of difference. But the thing that is important to notice is that there are different ways of inviting people in for those 2 services. So if you have receive a call from your GP or a text from your GP, that will be how you receive that vaccine, and the appointment will be made through either a phone call or from a text message. However, you may also be invited to one of the mass vaccination appointments, and you may have already received a letter from the Wembley site. You don't have to go to the Wembley site. We will have it more locally if that's more convenient. But what you'll get is a letter, and then you'll follow a link in that letter to book the appointment, or telephone somebody if you need to speak to them instead of going online. So either way, you will be contacted before you get your appointment. So please don't phone or drop into any of these centres or your GP service, because they're not going to be able to make those appointments any quicker for you. So I think at that point, I might ask Alex to go back to Alex, and then Alex, you can take us through questions that I haven't answered. I'm sure Carol can help me as well.
Thank you, Genevieve. So I think we're now going into the panel session, and on that basis, we just looking at the questions. So we've got currently 49 questions open. We've had 30 questions answered. So this is very busy in terms of the questions that we're being asked. In terms of the interest of time, and obviously trying to give you the rest of your evening as well, I propose that we have the next 10 to 15 minutes on trying to answer some of these questions. And following that, we'll just do a poll where you can give us some pretty quick feedback as to how well you found the evening. We've got over 300 people who are on the call this evening, which is great. So obviously we've got quite a lot of interest in all of this. So some of the questions in terms of groupings, I think there's some things around here which I'll ask both Carol and Genevieve for their thoughts on, around the change from the before Christmas getting vaccination within 28 days of your first jab, and the fact that we've had a rule change on that, and just making it clear to people where understand what the logic of that rule change is, and the fact that people are still safe going now into a 3-month period between their first and second jab rather than the 28 days. So Genevieve, I see you nodding. Do you want to just cover that first, and then Carol, just hand over to you if there's any other things that you just like to add on that?
Sure.
Certainly, Alex, thank you. So this may get slightly technical, so I'm just going to apologise in advance if that happens. So when any new vaccine comes out, and we've seen many, it's very, very common for people to have an initial dose and then to have a booster dose. And that is just the way that they, as manufacturers, want to be sure that they've reached the correct levels of vaccination level. So when all of these vaccines were developed, the 3 we're talking about, they basically worked on the basis that people would have 2 doses. And Pfizer originally based itself on the fact that it needed to have another booster dose after 3 weeks, AstraZeneca after 4 weeks. But when they have looked further at the data, they are confident that it is completely fine to leave the second dose until a little bit later. And by leaving that dose a bit later, it will enable us to get more people covered with a vaccine than it would have been if we had kept to the original dosing schedule. So I appreciate that's quite a change, and lots of people have asked lots of questions about that, and I'm really glad that people have asked this evening. But when we look at the actual raw data from the vaccination research that they did, we've got some really strong evidence that those efficacy rates are very, very good. What we know is when people initially have the vaccine, and it actually gives me an opportunity to say this, when people initially have the vaccine, they are not protected straight away. It takes time for the vaccine to do its job, to work its way through and to give people protection. So we know that for the first 2 weeks or so after you've had the Pfizer vaccine, you're still susceptible to picking up COVID infections in a very similar way to somebody who hasn't been vaccinated. But once you've got past that 2-week period, we've got really strong evidence that actually, although other people who haven't been vaccinated continue to get infections, the people who've been vaccinated with Pfizer actually hardly ever get an infection. So although that data was also then showing what happened when you had a second dose, it doesn't seem to make a lot of difference. So we've got time to wait for that second dose to reinforce the first dose, because we know that first dose is incredibly effective actually, which is really good news for those people that have it. With the AstraZeneca vaccine, they did specific research that made them look to see whether they could extend out for the booster dose to 12 weeks. And they were also very confident that it gave the same level of protection. So initially, the government made, and the JCVI, in fact, which isn't a government body, it's an independent one, they went along with the dosing schedule from the manufacturers. But when they've gone back and had the opportunity to look at the real data, not just the manufacturer's data, and actually looked at the experiments that the scientists did, they are confident that this is the right approach, and as well as that will enable us to save lives. So that's my thoughts. Carol, I don't know if you want to say anything more.
I thought that was excellent, Genevieve. So I don't have anything else to say. Yeah.
Excellent, thank you both. So there's been a number of questions and some clarifications just around the how contact will be made via, because someone is putting there around, is it text, is it via letter? Genevieve, I don't know if you just want to reiterate how that will be managed again. And then just in terms of trying to take some other questions as well, just a reiteration of those priority lists of access to vaccination and how that will work. I mean, I think some people are wanting a bit more clarity on timings, but obviously there's a number of variables in play around that. And I'm not sure we can give that at this moment, but perhaps just covering those 2 points at this stage.
So we, so the way that you will be contacted is it could be a number of different ways. The main three are your GP surgery could phone you. And if you're not in, don't worry, we will phone you back. Or if you missed the call, don't worry, we will phone you back. Or we'll send you a text. This is now likely to become the most common way because we've got a slightly different piece of kit that will enable us to do that quickly. And what will happen is you'll get a text and you'll follow the link on the text, and it will take you onto a website that will enable you to directly book your appointment. Alternatively, you will get a letter either from your GP or from the mass vaccination site, and they will then in that tell you how to book your appointment. So those are the three ways that you will be contacted. At the moment, we are concentrating on our top 4 groups. So these are the JCVI's top 4 groups. They are those people living in care homes and care home staff, those people over the age of 80, people who work in health and social care, under 70, under 80s, but over 75, so 75 to 79, and then our 70s to 74. So by the middle of February, we aim to have done all of our patients who fall into those 4 categories, as well as those people who are extremely clinically vulnerable, the people that we think of as using the term shielded.
Thank you, Genevieve. Carol, was there anything you wanted to add to that at all?
No, I think Genevieve's doing a fantastic one-woman show here.
Excellent. So,
Alex, can I?
Of course you can, Sean.
Yeah, just a couple of comments that I wanted to make. I think questions in the chat are really good, and I think it's very helpful because my sense is that people who are on this call are very representative, I guess, of the Harrow community, given the background that people have. And what this will do is it will give us the information that we need to be able to provide information. And it's very clear to me that people are extremely hungry for information. I think what it's also worth mentioning as well is that we have gone from no vaccination to vaccinating over 4 million people in a very, very short period of time, and at a pace that no other country has managed to do. I think it is absolutely clear that it's not perfect. to use a technical term, it's a bit lumpy at times. Information is sometimes a bit sketchy. But I think that what we are seeing is that as almost every week goes past, there's more vaccination, there's more information, there's more routes via which people are getting contacted, and it will get better as every week goes by. And when we get the mass vaccination site up and running by the middle of February, by the end of February, there'll be thousands of people getting vaccinated every week in Harrow, much more than there is now. I think it is understandable that people are impatient for that, but it has been an inordinate logistical challenge. And again, while vaccine supply is getting better, and actually North West London's had a lot of vaccine supply this week, there is still some limit on the speed of rollout due to the availability of vaccine. But I think we can be very confident that as every week goes by, more people will get vaccinated, the communications will get better, and the way in which we can deal with this will improve. But we are still at the beginnings of effectively the biggest medical and logistical exercise probably the country's undertaken since the Second World War.
Thank you, Sean. I'm conscious of the fact that we've got 112 questions all in all, and I think we'll be here till past midnight if we tried. Oh, it's now gone up slightly more. So I think what I'll do, one final question, and then we'll go to the poll. And then after that, I'll just wrap up on one of the things that just to say around wrap up. We will take all of these, as Sean has said, to move into our communications and our overall Q&A on this. But that one question, I think both for Carol and Genevieve, is just around what the vaccination means, that the transmissibility of COVID. So I guess what the questioner is probably trying to get at is, if you've got the vaccine and you've had the second dose even, does that mean that you are not transmissible in terms of if you have the virus? I think that's probably something that I've seen a couple of times within the question. So Carol, I might come to you first on this one, just so that you have questions to answer more so than Genevieve potentially stealing your thunder.
I've been frantically typing answers while Genevieve's been talking. I wish you'd gone to Genevieve first, because it's a really difficult question. The vaccines, we know, are they work in two ways. When you're looking at how efficient a vaccine is, it can either prevent you from getting the disease or it can prevent you from getting the infection. And we know that these vaccines are very good at preventing you getting the disease, preventing you getting severe disease, and reducing the risk of dying, which is why we're focusing them on the most vulnerable people and the people who are at most at risk. What is not as clear is how well these vaccines will prevent you from getting infected. And infected, I mean, the whole way that a vaccine works is you get exposed to the vaccine and then your body produces antibodies against it. So you have to have some level of infection, but whether that level of infection is enough to infect somebody else is not completely clear, which is why if we get everybody vaccinated, then they'd be at individual lower risk, and we would have less virus in the population. But that is a really difficult question, and it's really it's a very difficult question. But they're continuing to analyse the data and continuing to take swabs off people who have been vaccinated, so that we can get that answer. And the hope is that it will prove to be as effective. But the primary endpoint of all the vaccine research was to try and reduce the amount of people who had severe disease and had and were dying from COVID. I don't know whether Genevieve wants to say anything else. Is that?
Thanks, Carol.
So we hope that in a few weeks we'll be able to say, yes, we've got the evidence now that it does protect against that, but it might be a few weeks while that analysis is being done.
Can I also say something else, Alex? So I think Carol's absolutely right on that. And I think the other thing to just bear in mind is that people who have received the first dose, and even if you've received potentially the second dose, because occasionally people have had that, please don't change your behaviour. I can't reinforce that enough. I know it's incredibly frustrating. I know people are desperate to get out and about and get back into circulation, but it's really important that we still maintain the important aspects of looking after ourselves and others that we are doing. So, so fantastic if you've had the vaccine, but if you have, don't change anything at the moment.
Yeah, follow all of the guidance that we continue to issue in order to, so that we can break the chain of infection within Harrow. Yeah, because the vaccination is just one angle of that rather than the overall and the only angle towards all of that. So brilliant, thank you very much. So can I thank all of the panel this evening? Sudesh, are we able just to push the poll out to everybody? I think we can get a pretty good live response on this. Is that going up? There we go. So if people could just tick that, I think we'll probably have about 15-20 seconds. If you could just respond as immediately as possible, and then Sudesh will be able to flash the results up on screen. Hopefully all positive in terms of people have found it informative, etc. But where you haven't, obviously let us know, and we'll try to do our next one so that we improve and make sure that messaging improves and the subject matter that we cover as well. So have we got a result from that, Sudesh?
Yes, there we go.
Coming up on screen, is it? There we go. So this COVID-related webinar was useful to understand more about, so 92% of you thought that, to understand more about the local NHS vaccine rollout, 85%. Understand what we need to do as members of the Harrow community, 67%. Okay, so there's more we need to do just in terms of supporting you, I think, in terms of key messaging coming out, which we'll do as a follow-up to this session. So thank you all very much for coming along this evening and joining the webinar. It's been really, really helpful to have so many of you, and thank you all for the many questions that you have posed to us, because as Sean says, that will certainly help us direct some of our communications and our engagement going forwards. So it leaves me just to say thank you very much both to Carol, to Genevieve for your presentations, excellent and very informative, and also to Sean for covering the overall view of the local authority, and in the absence of our leader Graham Henson, Councillor Graham Henson, covering the areas that Graham would have wanted to have gone through. So thank you all very much. We've shot over time slightly, but forgive us for that. Obviously a very important subject matter. Let us know anything that you feel we've missed. Stay safe. Thank you and good evening.